And we will try to create some more understanding and take a look at more at the opportunities together with a very high-level panel. So I invite you to take a seat together with Helena Nordenstedt. But I would also like to welcome Marijke Wijnroks, which is the Chief of Staff of the Global Fund to AIDS, Tuberculosis and Malaria. And you have a broad responsibility and particularly focus on gender and human rights, and have been an ambassador for HIV/AIDS and sexual and reproductive health, and also Deputy Director of the Social Department in Netherlands. Very much welcome. Liljestrand, you are Senior Program Officer of Maternal Health at the Bill and Melinda Gates Foundation. And you have a long and distinguished career. You've been in Mozambique and working on the field for various organizations. And Ingo Piegeler, which has a distinguished career with the inside of the United Nations. And you are the Humanitarian Coordinator based in Geneva for UNFPA. So very much welcome. And I would like to start with you, Marijke. What do you think are the challenges that we are seeing now when we are trying to implement the SDGs when it comes to the fragile states?
And thank you very much, and thanks for inviting the Global Fund. I'm quite intimidated to be surrounded by so many smart Swedes. If you allow me, I would say then a few things how in the Global Fund context we look at SDGs and fragile context, and maybe starting with explaining what Ulrika Modéer already mentioned, that the Global Fund talks about challenging operating environments instead of fragile states. This was a term that was first launched by our technical expert and review group, and initially I thought it was semantics, but when I started to understand why they use the term, I realized it's a better way of reflecting reality in those settings, because fragile state fragility is usually not confined just to the state boundaries. It can be regional as part of a country, like for example in northern Kenya, northern Nigeria. It can also be a regional character, as we see very clearly now with the refugee crisis in Syria. So the Global Fund developed its strategy, the Global Fund board adopted our strategy 2017-2022 at the end of last month. And before we started consultation for the strategy, we called together a group of experts from different parts of the world in different sectors to look at what we call the development continuum, the context ranging from the very conflict fragile states on the one hand up to the upper middle income countries with concentrated academic on the other hand. And the Global Fund engages with all of these different contexts. And so what's in the different contexts, what's in each context is the best way for the Global Fund to engage. And that became very clear that we had to do more and better on challenging operating environments, because 1/3 of the global disease burden of AIDS, TB, and malaria is found in those countries. Approximately 1/3 of Global Fund funding goes to these countries, and that's for the 2014-2016 period, that's $4 billion, so that's a lot of money. And performance, not surprisingly, has not been as strong as a more stable context. And I was, as Helena was presenting the definitions of fragile states, I was comparing with our own. We struggled with the definition. We have 30 countries that represent the 30 countries that score highest on the a range of external risk indicators, and it's a composite index. I think there's like 15 different indicators, so just illustrating how very complex it is. So at the end of last month, the Global Fund board also approved the first ever COE policy, and we committed to do more and better in challenging operating environments, and that's also what we committed to at the World Humanitarian Summit last week in Istanbul. So in our approaches will be more flexible, more innovative, and work with expanded partnerships. And we will aim, in line with our mandate, to expand coverage for AIDS, TB, malaria prevention and treatment programs, but we also will invest in building resilience through stronger community and health systems. And as we care deeply about leaving no one behind, planning should be rights-based and gender-sensitive. State Secretary already mentioned the impact of conflict of women and girls, the gender-based sexual violence, and also rape as weapon of war that's very persistent. But also human rights, it's not an add-on, it's an essential and planning, because you know that groups that are marginalized in many societies, like the LGBTI, sex workers, and IDU and HIV context, but also migrants, they will be even more marginalized in times of conflict. And we're building on many years of experience, so it's not new engagement, we want to do better. We've explored innovation over the last couple of years, We established in 2014 an emergency fund that can be deployed very rapidly within 24 hours to respond to acute crisis, like we did for the earthquake in Nepal. But also in the Ebola-affected countries, we use the emergency fund to fund mass bed net distribution campaigns and mass drug administration for malaria treatment. And research has shown that that has saved thousands of lives, but also unburdened the Ebola system, because malaria and Ebola are so similar in early stages. And post-Ebola, and that's where the flexibility comes in, we've adopted really streamlined and flexible approaches to accessing funding and allowed countries to access funding based on their national health sector recovery plans. And another innovation was in the Middle East, very recent, where we are moving from a country-by-country approach to a regional approach. Basically following the people, as the state secretary said, and not the countries, and also allowing support to Lebanon and Jordan, countries that normally would not be eligible for Global Fund support because of their income status, but they're struggling with the huge influx of refugees from Syria. So that's all what we're doing, and we need to continue to learn. I met with the Minister of Central African Republic last week during the World Health Assembly, and we've been supporting the country over the last years with programs that really were limited to the bare essentials of malaria and TB and some HIV, implemented by civil society, mostly IFRC and MSF, who've done a brilliant job. But now that the country is more stable, we also have to work with the government and the ministry to see how we can long-term build the public health system capacity. Coming back to the SDGs in Horizon 2030, and also Elena in her presentation already alluded to it. If you look at the projection for economic growth, I think we can safely predict that most countries are currently, countries will continue to move up into middle income and high income category. And we'll see increasing concentration of poverty, poor health, lack of education, infectious diseases in the small group of countries that will be left behind. So it's really our imperative that we continue to focus on these countries. Global Fund allocations are based on poverty and disease burden indicators, so I expect that as we evolve, that the COE portfolio in their overall portfolio will become more important. But we also hope that together with all our partners, including Sweden, we'll do a better job in addressing the needs there. Thank you.
Thank you. Do you see a risk of removing for MDGs, which were so focused on the most poor, to SDGs, which are universal in your work?
No, in a way not. I think the MDGs provided a very clear framework to focus on pressing health issues. I think we also have to move, and we are with our new strategy very much moving to a much more people-centered focus to leave no one behind, which is really important for us, and also to work across sectors. For example, we're now funding education programs, at least incentive programs, to address the need of adolescent girls in Southern Africa, because we have to look at the person, what the person needs, and not just... So the MDG was very helpful until... because it was needed at that time, but I think we're now at a time in history where we have to move on and look at more comprehensive approaches.
Ingo, as we are moving on, we are looking at the worst humanitarian crisis when it comes to refugees, looking at Syria, looking at the influx and so on. What is the challenges that you see from your perspective?
All right. Can you hear me now? Yeah? All right. Yeah. Coming now from Geneva, I arrived yesterday. I've been asked my colleagues how to best respond to the various questions I may be receiving today. However, I think I should maybe talk more about my experience. And if we look at fragile context, fragile states, the one thing for UNFPA, which they all have in common, is marginalized women and adolescent girls. They all have that in common, in one way or another. It's because they're marginalized that they become vulnerable. This marginalization, this continued marginalization of women and girls makes women and girls over time vulnerable to all kinds of things. Vulnerable to sexual exploitation, vulnerable to having not the access to the basic health services one would think would be available during or in a given country. They would, because they don't have these continued or basic accesses to health services, particularly to sexual and reproductive health, they cannot focus on things such as family planning. They cannot focus on their own health. They cannot focus on the health of their children. If we can get it right to focus, maybe as an entry point, on strengthening the capacities of these fragile states or fragile institutions, in focusing more on providing this access to this basic and continued care in terms of sexual and reproductive health, we believe that we can maybe shift things around by having healthy families, by having in place systems which actually look at women differently. Look at women not just as a vulnerable population, but as what often the private sector looks at them. If you look at the private sector, and the private sector, I remember it very well from the build-up to the Sendai conference on disaster risk reduction, the private sector doesn't look at women being vulnerable. They look at women being the key assets to turn it around. They look at women in such a way as the woman could be the key actors for positive change in addressing long-term causes of fragility with regard to natural disasters. Obviously, this is much more difficult when we look at conflicts. In protracted crises, if we just would think a little bit more in terms of what actually would make a society more resilient, what would bring young girls into schools, what would help mothers to insist that their daughters go to school, it always tallies back to a healthy society. It always tallies back to women being healthy and empowered. So if we look at, if we try to maybe look also at this empowerment, not just from a health angle, but also from a nutrition angle, from an angle to not just address or register acts of sexual violence against women, but also in terms of going after those people who actually who rape women, who mistreat women. If we look at things around education of children, of boys, of young men, what means actually gender equality, why gender equality is important. It's not just important because, it's the norm which the Ministry of Education is trying to make us understand. It's because for our own good. It's because if we have our own future wives, our sisters, our mothers empowered, we will be able to strengthen our economy. And that brings me now to the final point. Adolescents, girls, young men, we all were once adolescents. We all looked at one thing when we started our lives. We looked at financial independence by having a job, by having employment, by having some kind of income-generating activity which helps us to sustain a family. So if we look at this aspect of employment, of income-generating activities, towards the need of young women to make their own choices, then it's quite clear, for us, for UNFPA, it's quite clear we need to focus much more than we have done so far on adolescent girls and young women. Now, this is, from my side, an offer an offer, if I can may say, on how we could maybe start doing things differently. We are now in 2016. A young woman or a girl who's 10 years old, by the time of 2030 will be around 25 years old. So what we need to really achieve in these next 15 years is that these young girls, when they become young women, can actually thrive on the Sustainable Development Goals, especially thrive on their achievements. That's again, I'm sorry if I don't have maybe well-defined talking points on my lap here, but I do believe that we really need to focus on what we always talk and think about, but never really tackle, We need to focus on adolescent girls. Thank you very much.
Thank you. Jerker, Bill and Melinda Gates Foundation, you are a global actor and you have a huge experience of working with violence against women and sexual reproductive health and so on, and you are focusing. What's the most important perspective from your point of view?
I think I would like to give a further spin to what has been said here already by the three previous panelists, our Secretary of State and Ingo and Marijke. The Gates Foundation states that all lives have equal value, and they also wish to place women and girls at the center of development, more or less exactly as Ingo pronounced it. We are very much on the same page. And perhaps during the MDG era, we have worked through, many of us here in this room, perhaps even though there were many, many challenges, perhaps we picked some of the low-hanging fruit during those 15 years. And now we need to really change gears and look, where are the health challenges as we go ahead? I'm sorry for this. It's a little bit intermittent, isn't it? So I really salute the topic of this meeting today, conflict, poverty, and fragility. We cannot just go on, do business the same way as before. And this was very eloquently showed by Helena, that to really address the issue of people living under conflict, poverty, and fragility, that needs something different. I would like to argue, of course, I'm very biased. You have given my maternal health background, but I would argue that as we work in fragile states, one of the things that must be done early on, as has been said, is maternal, newborn, and child health, and expanding to the broader reproductive health agenda. For two reasons at least. One is because these are the most vulnerable people, and these are the future of development, as has been said. The other is, in my view, in my experience, and what we can read is that the let's say vertical approaches of immunization and also some of the work we can see on HIV/AIDS, very successful work that we are very thankful for, but it has been more vertical in nature. But you cannot do that when you want to develop maternal, newborn, and child health. You automatically address health systems issues like the supply chain overall, like the gathering of some local statistics that you can use for local planning, call it HMIS, Health Management Information Systems if you wish. But you automatically will address the health systems agenda, meaning that you will also, the things that you do on the maternal, newborn, child health side will also eventually benefit the care of accidents, for instance. So women, girls, maternal, newborn, child health, reproductive health, these are things that have at least two justifications for us to address them. And I think it's important in this room to say that reproductive health issues cannot wait until some later time when the peace has come and the state is reorganized. These are things that need to happen now. You need to be there with contraceptives and other aspects of reproductive health. So these are important. And having the floor for just a minute, I'd like to give a message especially for Sweden. And Sweden, of course, has been a groundbreaking country when it comes to sexual and reproductive health and rights. It has really been groundbreaking, and the voice of Sweden is important. So I would like to just make a plea for Sweden reconsidering joining the Global Financing Facility, the GFF. For those of you who are not fully informed on this, we have global funds for vaccinations, Gavi, the Global Alliance Vaccine Initiative. And we have the global fund that Marijke represents that deals with HIV/AIDS, tuberculosis, and malaria. And now, since a year back, there is the conception of a new fund, the Global Financing Facility, that is somewhat different. But it addresses reproductive health, the Global Financing Facility, reproductive health and the health of women and girls, which somehow has been something many of us have been wishing for. Why do we have these other two global funds, but we don't have a Global Financing Facility for women and girls and reproductive health? And now we have one. It's still a bit of an experiment. It still needs to be shaped. Sweden has chosen to stay out for formal reasons, which I well understand and respect, but we are discussing how these formal reasons can be overcome, and let's say that Sweden can join in and shape this in a way that can make it satisfactory also for Sweden. So that's my final message, and that to me is a current challenge right now. Thank you.
Thank you. Ulrika, the government started off by launching a feminist foreign policy. And we are basically talking about health and fragility, and it all comes down to women and girls. What is it that Sweden can do when it comes to this perspective? And do you agree that it's actually about women and girls? What is it? Have you already shaped the landscape by the feminist foreign policy, or what is it left to be done?
No, I think that the feminist foreign policy is a very good way of keep pushing ourselves as Sweden, being an important player in this field for many decades. But we need to improve, and I think that the policy discussions with regard to sexual and reproductive health shows this. I mean, we took important decisions back in the 1990s with regard to this area, in the Cairo meeting, for instance, but we see now, even in Europe, that we need to take these discussions once again, and we're actually not moving forward, but as Sweden, trying to see that we're not moving backwards sometimes. So it's really important for us to keep up the feminist analysis within all areas of the Sustainable Development Goals. And I think that the sexual and reproductive health and rights are actually core business. If I talked about health as core business, I think that sexual and reproductive health and rights are actually core business within the health area. And of course, we need to see this as important as it is in the conflict-ridden areas, but especially also for the young and coming generations, as have been said. But I also wanted to address, because it sounded a bit mysterious, that because of formal reasons, Sweden has not taken yet the decision to be part of the fund. But the formal reasons are actually the ones that I explained, saying that we need, as agents of change, being back donors, policy makers, those who actually do the work on the ground, we need to organize ourselves. And this is why I put such a great importance on the core funding. We have a huge system of actors, and sometimes Sweden believes that creating new funds is not perhaps the most efficient way of working. These are the formal reasons. We want to find responsible ways of really strengthening the different systems, supporting the systems on the ground. But then we know that and this was also something that I mentioned, that we don't have so many like-minded in this, but we want to bring the discussion because we think it's so important. And many times we move into the different new funds that are there because we also want to engage and to see to that they are being developed in the best way. But I do believe still that we need to get back to basic. We have promised ourselves as an international community to commit to efficient development and efficient ways of working with aid and development cooperation. And many of us that have done this for decades, we know how to do this, and we need to be responsible with regard to this discussion as well. But we need to have it, but also to see how we can be good partners in different new initiatives.
Thank you.
We have touched upon some important issues here, and I think we have also set the perspective. What I would like us to focus a bit more on is what is the actual barriers, because we talked a lot about what is it that should be done, but what is the problem that we're not managing to achieve that? What is it that we're actually seeing on the ground which is preventing us? Marijke, what would you single out as the most important areas where there is a need of improvement, there is a need of better focus, inside of fragile areas?
I think if I just look, for example, of Central African Republic, it's a country where donors walk away because of the high-risk environment, where there's very low capacity. So I think that's a fatal combination of lack of resources, lack of capacity that makes it really difficult to make progress. So in a way, it's we had a discussion at our last board on risk tolerance. I think if we really want to engage in challenging operating environments and make a difference there, we should define what risk tolerance is. Because if you have if you don't accept risk in working in these environments, it's going to be really difficult to make a difference.
Ingo, what's your perspective, and what's the responsibility of the United Nations, and what can be done when it comes to lowering the risks?
Yeah, I think we need to be bold. I heard Ulrika saying that there have been strides towards bringing forward the SRHR agenda, but also even within Europe we have seen some resistance. We need to have a discourse which uses intelligence in such a way that we talk to those who are opposed to us. So if we look at people who are afraid of change, people who perceive the empowered woman as a threat, and we still do have that, even in Europe. If we look at these people, if we look at people who are at groups who are quite successful in quite well funded in certain cases, we need to make sure that but in our way, in advocating for human rights issues, for women's rights issues, for access to basic services for young women, we need to make sure that while we advocate, we don't create further sensation of fear. If I may just give one example, during the build-up of this Sendai framework on disaster risk reduction, we UNFPA were sitting as all other UN agencies further in the back and listening to the discussions and listening to the inclusion of text into the outcome document. The simple inclusion of the word sexual created a lot of resistance among the not so like-minded. It took us months in discussions or in one-to-one meetings with those not so like-minded countries to succeed in having the word sexual inside the framework itself, which makes a huge difference. Because sexual and reproductive health, which stands for maternal health and which is GA agreed text, was not accepted until the very last moment. It only was accepted because we were perseverant. We were not giving up in terms of pushing the agenda. So we need to push the agenda. We should not be afraid. And I speak especially to the young woman in this room here, because we need you. We need you to help us, just not walking the talk, but convincing the world that it doesn't go without empowered women. It's just this kind of message we need to push through. If we go into a situation of confrontation or of this is the way how we think things should be done, that's fine. We can have our position, but we need to keep in mind that in order to convince the other parties, we need to learn how they think, how they perceive things. It's only through that kind of intelligence that we will be able to actually change the course for the good.
Jerker, you want to step in?
Two things. Innovation has been mentioned this morning. We need innovative approaches. And while we are speaking of a whole range of different environments in fragile, poor, and conflict states, one innovation that may not be what we would suggest if we come from an established state with a functioning health system, what we may want to consider in a country in conflict or with a non-existent or extremely fragile health system is working with community health workers to make sure that what are the interventions that you can start providing on the ground so that you provide something so there's some kind of credibility. And I'm sure Anders Nordström this afternoon will speak how you kind of try to both reorganize and revitalize the system in Sierra Leone. But thinking of it was actually also one of the things that was missing when you tried to combat Ebola. It was the linkage down to the community. So it's a very logical point to start providing, both family planning and iron tablets, perhaps immunizations, but there's some kind of something that starts reaching people. So community health workers, and it's not to justify us, but that's one of the things that we have decided to do in northeastern Nigeria, where Boko Haram is. So the Gates Foundation has entered into a contract with the government to start community health workers aligned with the national policy. The other thing, totally different, was mentioned by Ulrika, and that's the intersectoral work. If you are growing up in a refugee camp, a Palestinian refugee camp in the Middle East, perhaps one of the few things that can bring you forward is for a girl is to get education. So we're speaking intersectoral, that everything is not health, and the very, very vulnerable people that Ingo and others here have spoken about. So innovation and intersectoral work is perhaps extra necessary in these settings. Just two cents worth there.
Ulrika, yeah.
In line with this, I mean, if you provide basic health services, I mean, you start to create trust also in the possibility that actually local institutions, being at some point civil society or and at the next point perhaps local authorities, actually can provide public goods. And this is, of course, a very important step towards creating a more stable environment. So I just want to stress the same thing.
Yeah. I think we have 2 questions from Twitter, and then we have a microphone for them who the audience, which will have to wave in order to engage and enter the discussion.
Okay, so we have some questions from Twitter. Now you can hear me. We have a question from Moa Hergård, which is, will we reach the goal without a political and democratic change in these countries? And the second one, which is also from Moa Hergård, how can EU, or Sweden in brackets, consider to accept Turkey and still claim working for this goal with Nexus approach solution? I think we can start there.
Ulrika, you mentioned that there is no development without security or peace, and there can be no peace and security outside of development. So where do you start off in these fragile states? What can we, and Jerker, you talked a bit about it, what is it that we can build when it comes to health systems and so on, when we don't have a state structure? What is it that is possible for the international community to do, and what is it that we cannot do before we're guaranteeing peace? And Ulrika, what is your experience when it comes to the agenda of these non-conflict or semi-conflict states? How important are they on the world leaders' agenda?
Well, I think, I mean, if you look at Europe, I think Europe is quite concerned about the conflict-ridden states quite close to Europe. And with regard to the question from Twitter, someone at Twitter, I mean, asking whether Sweden accepts Turkey. I mean, we would not accept governments that don't oblige with the norms that we have set up, the international standards for human rights or other international laws. But at the same time, we have to accept the situation that those who need the help the most, they live in countries where we cannot accept the governments. Yeah. And we have to relate to this and to the governments. And the only way to do this is to find a way of dialogue and together with others to find ways forward. And I think that we need to focus, and this has been said many times now, I think from all of us in the panel, much more on delivering improved development cooperation with countries, but also with different actors working in countries and regions where the people who need development cooperation the most are living in the most difficult circumstances. Because otherwise we will see, I mean, what we will see in the future are the people really living in most poverty will be those in the conflict-ridden states. This trend, and with more conflict and also with other challenges that we see ahead of us with regard to climate change and other natural disasters and so on, we will have a huge problem that we can actually avoid if we concentrate to work in a different way from now and onwards. So we need to focus much more in these areas.
Ingo, would you say that the world leaders, United Nations, have enough of a pragmatic approach and at the same time as they're pushing governments who are not democratic in order to develop? Or is it that we are daring a bit to touch upon them and therefore we are not reaching?
Well, in our interaction with governments, we have to always depart from the principle that they are sovereign states. That's the first thing. What we can do is to provide them the advantages of investing in, for instance, in the youth, investing by changing existing social norms, investing by ensuring that their own economies get out of this permanent state of dependency. You can do this by, again, putting yourself into their position. So yes, what do you do in a fragile country which sees its youth rather leaving that country, reaching the European shores, for instance? What do you do in order to help these governments ensuring that these youth rather stay in these countries? And one thing would be to help them creating programs or running programs financed by by quite a large number of funds we already have in place. The latest we have seen was during the WHS from UNICEF, education in emergencies, by creating programs that allow the youth, once they have reached the state of having a diploma, having some kind of basic education, to actually run a job, have some kind of financial stability. If we can help these governments to understand how important that is, if we can work together with these governments in creating these programs, A, we would have these youth staying in the country, B, we would have these youth not becoming desperate, and C, desperation often leads this youth to believe that the only way forward is to be radicalized in one way or another, which we see also. We just have to look at ISIS. The large numbers of young men who are in ISIS fighting often do it, not always, but often do it because they need some sort of of sensation being recognized in having some kind of a role. What kind of role it is, we can debate. But what we need to do is, we need to, one thing is we can talk to Turkey by saying, Turkey, what you're doing right now is not what is according to international norms and standards, but we need to help Turkey as well. We need to help the government and the people of Turkey to understand what it means to have an empowered youth, and understand what it means to have a demographic dividend, and using this demographic dividend, having them have youth who have a productive capacity, make them less dependent, having them participating in the development of the country. So these things take time, of course, and a lot of efforts, but without our continued engagement, we will definitely not reach them.
Marijke, you talked about creating resilient health systems and communities and reaching out. To what extent in the work that you're doing when you're fighting these diseases, are you also able to actually create a stronger civil society which can be a resilience against the fragile states and which can start creating a new momentum or some sort of community feeling which is starting off development?
Exactly, describing how I wanted to answer the question, because I think we have invested a lot in civil society in almost all countries. We fund both government and civil society also because we believe that civil society can better reach certain population groups and also to build that accountability. And increasingly we will focus on building community systems, because I think Jarke said that just the community is key, and the community is a key part of the health system. If you want to limit your health system to the public health system, you end up with health care but not with health. And so we're increasingly going to invest in communities and community systems.
Helena, do you want to
No, I was just relating back to my experience with the Ebola outbreak and seeing those countries in West Africa that were affected. We have Liberia, Guinea, and Sierra Leone all on the list of fragile states where the outbreak was really immense, huge, and we have 30,000 cases confirmed. Then we have the other states that were also affected by Ebola, close, the neighbors countries of Mali, Nigeria, and Senegal, where the Ebola outbreak never really, it was stopped before it became really big. And these were not fragile states, not according to the IDPS definition at least. So having a functioning state is a prerequisite to find these disease outbreaks before they become big enough to spread like they did.
We have a question from one of the participants, Göran Thompson.
Thank you very much. Ingo, you asked us to be bold. Now, the title of, or the heading of this session is, how can the SDGs related to health be operationalized? So I'd like the panel, if there is time for it, to be a bit bold. There are 13 targets and concrete in SDG 3, and another 7 targets in 4 other of the goals. And it's been an interesting but not very specific discussion. So given the situation in the fragile states, or whatever you would like to call it, how do you see in real life operationalization of this? And thinking not just with a 12-month perspective, but again, as was alluded to, with maybe a 10 or 15 years perspective. Where to start? It's a complex adaptive system, but I mean, if we have the framework and you haven't actually used the targets very much in your discussion. Thank you.
So what do you say more specifically on the targets? Ingo, you were set out to start.
Well, yeah. What we need to ensure is that the targets, that the SDGs themselves help fragile states to strengthen their institutions. Henrike has mentioned it, Helena has mentioned it earlier on. Countries neighboring those where the Ebola epidemic was the worst, but who somehow were able to stop the spread of Ebola, have somehow in their countries functioning institutions, functioning health institutions. And we're looking just at the neighboring country of Liberia, which is Côte d'Ivoire. Côte d'Ivoire went through a massive political crisis, but through the entire political crisis, the country was able to maintain basic health services. With the new government coming in on board, these health services were further strengthened. Information was circulated, and the state, the central government, was able to contain the spread of Ebola. What we need to do is, for all the SDGs, we need to use them in such a way that we strengthen existing institutions in fragile states. Only if we strengthen these institutions, we can strengthen strengthen further the access to basic services, not just health, education services, any services which help a society to become stronger, better informed. We were not talking so much here at this panel about the revolution of social media. Social media is something which is currently being used, ironically, by those who are trying desperately to reach the European shores. People are informed. People in these fragile contexts, in these fragile states, know that it could be better. But we need to advocate with the governments that they actually need to strengthen their institutions, strengthen these services to their own populations in order to get out of the fragile state they are in. So it's a continued, it's a continued work in terms of helping these governments having the institutions strengthened over time.
I think it's also a question that's quite impossible to answer because there are 169 targets. I think there's not one approach that can address all the 169 targets. And also because there's not one concept of fragile states and then have one recipe on how to be specific in implementing programs. It needs to be very context specific, and what you can do and you cannot do depends very much on situation. And the example I gave on Central African Republic is where you really fund. The only thing we could fund and that could be implemented during the crisis was very basic healthcare program, but some priority programs that could be implemented at the community level that would have an impact on the lives of people and on especially child mortality. And as the country becomes more stable, you can start to work with the government, work towards transition, build public health institutions, but that really depends from the context. So for me, the context specificity is really important in fragile settings.
I have to agree, the context specificity, and also, as you said, Jerker, the low-hanging fruits have been taken, but we need to use that and use that experience and the knowledge we have gained from picking the low-hanging fruit into making the SDGs happen. So the experience and the knowledge is there, but we need to contextualize it now for each country. So not a very specific answer.
I think the system, talking about systems of delivering on the Sustainable Development Goals is being developed as we speak. And I feel, as I said in my initial remarks, very encouraged by the actors working on the area of health, because I think there is such a good discussion going on, engaged discussion among a variety of development partners, sharing of experiences, sharing of knowledge, and I think that this is gives a good ground for different partners within the UN family, private sector, civil society, and so on, to really find their different roles, not only within what perhaps used to be the health sector, but actually also in relation to broader understanding of development in the conflict-ridden states and regions, looking at the discussion on Ebola and how it brought about a discussion on the importance of trust in between people and the politicians, looking at the healthcare systems and their relation to a broader state building project and so on. So I think I've not followed the health kind of side of or part of development cooperation very closely, but I feel very encouraged by what I see, and I think as government and as a government that wants to focus on working on good policies, but also on good development cooperation in where it's most needed. I think what's important for us is to give support to this kind of coordinated response from a variety of actors and be a careful listener and to see how we can really be of even more support. And then also, as I said, to have a very good discussion with the other back donors to see to that we together support the actors to be able to deliver on the goals.
My answer to my old course mate Johan is going really back down to the grassroots. And just coming up with one thing that I think we need to stress, and that is data collection at the grassroots level. Just to say something very concrete. And all the SDGs are numerical in some way, but to address the health ones, we have this mailbox syndrome. And we're not only speaking countries at war, we are speaking about Nigeria and Sao Tome and DRC and countries that don't have war, at least not all over. But I feel that if to engage your co-workers at the grassroots level, including civil society, including national NGOs, you need to have some kind of data and say, well, how many IUDs have you put in, or how many pills have you given, or how many women gave birth, and how many babies survived, and how many postpartum bleedings did you have? Now, the mailbox syndrome means what is happening in many, many countries, perhaps most, that you put something on a tally sheet and hand it upwards, and it's digitized somewhere, and then it finally reaches the Ministry of Health, and you never get anything back. And that's my point. The first and second and third priority for your data is it comes back to the people who need to use the data to count infectious disease cases of an outbreak or something, to operationalize and get those data back in some kind of innovative and even guesstimate rough fashion. It may not be perfect, but that you know at your grassroots level, whatever that is, what are you doing and which are the problems and how are people reacting? So I would toss my investment into collection and management of very simple basic data at the grassroots level. That is needed as one of many things that is needed.
This is a difficult discussion because in somehow the answer to all of the problems is basically that you need to create some sort of institutional structure which can develop to a state structure, which means that you can stress accountability, that you have a partner to act with, and that partner in somehow takes responsibility for its own citizens. And that is what is missing, and fragile states lacks all of those. I think there have been some important conclusions that can be drawn out of this discussion. One is that it's a country-based approach that is needed, that even though how we define fragile states, they are all unique, so there is no real framework that we can do into, and I think that is a huge challenge for the political side, which needs to find a specific way of entering each discussion in each country, and that is showing to the complexity. I think it's been said that women and children, women and girls, needs a stronger focus, and I think we have stressed the sensitivity within inside of that, which I think is a credit for the government's feminist foreign policy, which is not only setting that focus, but which is also challenging when it comes to values and when it comes to human rights, and I don't think that is perhaps talked about enough. I think what maybe the thing that I will take with me from this discussion is how health and can be a part of not only creating some sort of structure or institution within a country, but also trying to shape a civil society. Because where we don't have states, civil society and the community is basically where we can start off and try to form something and trying to find partners and work with them. So I hope that you, together with me, have been able to find some key conclusions. And my last question to the panel, which is then going to be very, very short answers because we're running out of time and I guess some of you have to run. But that is that when we're then looking at Fragile States 2030, even though they are country specific, what do you think was the main reason why we actually managed to take those 10% down to 1% or at least 0%? What is it that's going to be remembered? Perhaps not from this conversation, but from the actions that we took in 2030.
Well, we're talking about states. Yes, community-based approaches are very important. Data collection, disaggregated data by sex and age is all very important. But in order to reach 2030, we need to have strengthened government institutions supporting all these initiatives. So if we manage to have strengthened government institutions who actually provide these services, provide schooling for everybody, not schooling for those who are able to afford the money.
So government institutions.
Yeah, government institutions
is key.
They have to be strengthened by 2030. Yeah.
Marijke.
But I think there's a lot we can do, supporting civil society, supporting communities, building community accountability, and but ultimately I think it comes back to the question from Twitter, is that real change possible without a political and democratical change? It's not part of my mandate, but I have a personal opinion on it. I think not, but also I think we've learned the hard way that you cannot impose that from outside.
Helena.
More focus, that we are now talking about these days and realizing the problem and seeing that donors and different institutions and NGOs coming together with the fragile countries and trying to solve it together.
Jerker.
As a global refocus on this, the need to refocus on this for us all. This is not humanitarian aid that you can do as a charity. It's a global refocus on this issue for us to move ahead as a world.
Ulrika.
I agree with all of you, and then I get some plus, but then also of course focusing on girls and women their needs, but also, as was said, the importance of looking upon them as drivers of change, not only with regard to health, but also with regard to democracy and human rights and change in policy and practice with regard to these states that lack democracy and human rights.
Thank you very much. I then hope that we have provided some solutions. We will continue to gather solutions and we will address them and come back to you at the minister. And then we hope that we will continue to explore with more focus and with more political engagement, and then starting to build governmental institutions and thereby erase the fragility. So thank you very much for this panel. Give them a big applause.